The next question is treatment. So let's say somebody has done the colonoscopy and the biopsy unfortunately confirms that it is cancer. What do we do next? We need to have a whole picture of the disease in that particular individual, in that particular patient. So we need to do a CT scan if it is arising from the colon, and we need to additionally do an MRI of the pelvis if it is arising from the rectum. This is to ensure that we have a good idea what stage that we are dealing with. Is the disease still confined in the colon, or has it gone beyond the colon to the adjacent lymph nodes, or has it spread elsewhere to the other organs such as the liver or the lung or the bones? So normally your doctor will request for a CT scan of the thorax, abdomen and pelvis, and if it is the tumor arising from the rectum, you would also need to have an MRI of the pelvis. This is to have a clear idea of how do we need to tackle this cancer. If the cancer is localized, then the treatment is surgery. We are talking strictly about colon cancer. If it is a rectal cancer, I shall deliberate it shortly in a more detailed manner. If the disease is extensive, meaning if it has spread, then the role of surgery becomes more of palliating the symptoms but not to cure the disease. For rectal cancer, one of the things that we tend to see, we tend to establish is whether if it has breached a certain layers of the outer parts of the rectum. Now, the reason being is that we want to know this by doing the MRI is to know whether the patient can benefit from radiotherapy, or what we call radiation, prior to surgery. Those patients who have tumors from the rectum, giving radiotherapy upfront prior to surgery would add more benefit to the patient in terms of local control and reducing risk of local recurrence at the rectum area after surgery. It is a known incidence in rectal cancer that after surgery it may recur back at the same place. The tendency is there, so that is the role of radiation in giving reducing the risk by 2/3 to the pelvic area. And there are two types of radiation that we give. One is called a short course radiotherapy, and the other one is called a long course concurrent chemoradiotherapy. So this only applicable for the rectal cancer, but it's not applicable for the other parts of the colon. If it is arising from the descending colon, transverse or ascending colon, then there is no role of upfront radiation in early colorectal cancer. Then the treatment is straight away, patient goes for surgery if patient is medically fit for surgery and surgery is amenable from the surgeon's point of view.